Yes, here is your stamp.
Yes, ma'am.
Okay, so if you've read and understood, considering a surgical pathology station, please tell me how would you go ahead and manage this patient?
I would like to manage this patient according to the CCRIS protocol.
Yes.
I would secure his airways along with her. I would secure her airways along with her cervical spine.
Yes.
I will take care of her breathing.
Continue,
So,
please. Yes.
I will take care of her breathing and circulation, and consider for her disability.
Yes. And
Uh, I will if the airways are not intact, I would like to immediately pass an oropharyngeal airway. I will call for help and call for the anesthesia team to come and, if necessary, intubate this patient.
all right.
I will also take a call to
Yes.
ICU team to make an
ICU.
uh, ITU. I will also call to ITU to arrange a bed for this patient.
Okay, patient has acquired a head injury. See, so you know that. Now, CT scan has been done, right? And there is one finding. So, considering the record, patient is sickle, already has a sickle cell condition. What is the significance of knowing this disease? And yes, with the current situation.
Sickle cell disease is basically a common hereditary hemoglobinopathy,
Okay. And
which leads to the hemolytic anemia
all
and
right.
uh, 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 vaso-occlusive phenomena for this patient.
Okay.
And it causes polymerization of the deoxygenated hemoglobin.
Please tell me, this sickle cell condition, sickle cell disease, what type of disease or illness is that?
Sickle cell disease is basically a common hereditary hemoglobinopathy
Yes,
of
autosomal recessive.
this is an autosomal recessive
Yes.
disorder.
Okay. Please tell
Uh,
me, what is the difference in a patient who has adult normal hemoglobin and a person who is diagnosed with sickle cell disease?
a normal person has a normal hemoglobin, and it has the capacity to carry the oxygen,
Yes.
to transfer the oxygen to the vital organs and other tissues of the body. However, this sickle cell hemoglobin has the tendency for polymerization of deoxygenated hemoglobin. There is a defect in the hemoglobin. This is the reason it is unable to carry the oxygen and supply to the tissues.
Okay. Patients with sickle cell condition presents with typical signs and symptoms. Can you please describe?
A sickle cell patient can suffer from vaso-occlusive phenomena, and sequestration of sickle cells, sequestration of spleen.
Okay, and
And the vaso-occlusive phenomena is triggered by dehydration or infection
okay,
or acidosis in the blood.
okay. So the patients with sickle cell condition are already prone to or already are immunocompromised patients or immunocompromised patients or candidates. Yes. So what do you already expect to see in them or find in them?
As due to the
Very good.
autosplenectomy
Good.
or patients,
Yes.
these patients are prone to infection to the encapsulated organisms.
Very good. Give some examples of the organisms which can cause, yes, in immunocompromission
The
session.
encapsulated organisms which are Haemophilus influenza, Streptococcus pneumoniae, and Neisseria meningitidis.
Okay, this finding of temporal region mass, do you think it has to do anything with sickle cell condition, or is it just an incidental finding?
A mass can produce a compressive effects in this patient.
Okay,
For example,
that's
in the
yes.
temporal region, it can cause dysarthria in this patient.
Okay, can you name few primary brain tumors that can occur in elderly patients?
There are high-grade space-occupying lesions and low-grade space-occupying lesions. The
Good.
high-grade space-occupying lesions are glioma and glioblastoma,
Yes.
and low-grade space-occupying lesions are meningioma,
Okay. So
acoustic neuroma, neurofibromas, craniopharyngioma.
good. Can you tell me what are the manifestations of the brain tumor?
Uh, brain tumor uh, brain tumor can the presentation can the presentation could be is according to the location and size of the growth along and the presence of occupying lesion symptoms and increased intracranial pressure.
Okay.
And the symptoms can be headache. Most of the time, these headaches are worse in the morning, along
All
with
right.
nausea and vomiting. There
Yes.
can also be seizures. There can be focal neurological deficit, for example, diplopia
Yes.
and visual field defect.
What would
Uh,
you do in this scenario with the patient's mass? Would you leave it or would you operate on it? And why?
yes, this mass should be managed, and this should be decided by the neurosurgical team, as this mass can raise the intracranial pressure, and it can lead to the herniation of the brainstem, which can compress the respiratory center, and this can cause death to this patient.
Okay. Right. Thank you.
Thank you so much.
Right.